40-year-old Donata Mudhoni has lived with HIV for more than 10 years. HIV, or human immunodeficiency virus, is a virus that weakens the body's immune system, weakening its defenses and making the body easily succumb to disease and infections. She decided to get tested after falling sick and admitted to hospital with symptoms like diarrhea, vomiting and lack of appetite. Doctors refer to such conditions as opportunistic diseases that attack the body as a result of its poor immune system.
So when I was tested and told, but all I did, I was happy that I knew now my condition as a name. It's not just being sick.
Having been on antiretroviral drugs for the past 5 years, Donata has been able to live a healthy life, spending most of her time counseling people living with HIV. Here, they share issues regarding the use of ARVs, disclosure and using protection. Early signs of HIV include skin rashes, vomiting, instant weight loss, mouth ulcers and poor appetite. These can be controlled by use of antiretroviral drugs. However, some challenges facing people living with HIV is accessing ARVs, neglection by family, rejection and lack of a conducive environment.
If someone has been bedridden, the family does not want anything to do with them, so it's neighbors or anybody, well-wisher, will take the person to hospital and is dumped in the hospital.
Dr. Mogiro is a medical officer working with HIV-positive people at Mbagathi District Hospital. She says embracing one's status is the first part of dealing with stigma, adding that everyone needs to find out their HIV status.
Everyone should go for testing, whether they are ill or not. We encourage early testing so as to catch the patient with HIV before the immunity is completely destroyed.
Statistics carried out in 2007 by the National AIDS Control Council stated that now fewer adults have had sex before the age of 15, and more Kenyans are using condoms with non-marital or non-cohabitating partners. There was no decline in the proportion of people with multiple sex partners in the year prior to the survey. Among married individuals living with HIV, nearly half have a partner who is not currently infected. Nearly 2/3 of adults aged between 15 and 64 have never tested for HIV. 83%, or approximately 1.2 HIV-infected Kenyans, do not know they are infected. Regarding nutrition, doctors say people living with HIV have a higher metabolic need, meaning a good and healthy diet is recommended.
Their nutritional requirements are 10% higher than for a normal person.
Although there is no cure for HIV because it is a viral infection, there is a steady progress in HIV AIDS vaccine research. In 2007, 10 Kenyans were tested and found to carry powerful antibodies that neutralize HIV, stopping it from infecting new cells, a thing that may hold the key to developing a vaccine. This is according to researchers at the Kenya AIDS Vaccine Initiative. While there's no cure for HIV, the public perception that being positive is being sick can be quite confusing. But if they follow their treatment, live healthy and positively, people with HIV can live long and normal lives. Zein Noor reporting for Sunday Live.